Um, I guess one of my big reasons for, talking about C-sections and opening the conversation around C-sections is, first of all, I've had four of them, but it didn't come without a lot of angst and, stigma and stuff that I faced 9 years ago when I had my first. So, you know, um, we see a lot of questions being asked about C-sections. Oh, the rates are increasing. And, you don't really see the reasoning behind that or the numbers behind that. Or, okay, so why are they increasing? Like, what is it? Is it that, first of all, your birth is your choice. So if you choose a C-section, then what's wrong with that? You're able to choose vaginal birth. So you should be able to choose to have a C-section if you see um, it fit for yourself. And I mean, I have had patients who have come to me specifically for advice, which I don't give, but I just give sort of an idea of, okay, well, you do have the right, if you have anxiety around birth, to request or to look into or have a conversation with your healthcare provider about these things. Because going into birth anxious is not going to facilitate necessarily a very happy outcome. And so, that said, a lot of the moms that I have spoken to about these sorts of things, and they've gone on to speak to their health care providers about, have actually had very successful vaginal births after, thinking that they would best suit a C-section. So, I mean, you just don't know. And then, of course, there's, the whole, emergency C-section and what that can bring to the table in terms of emotions and mental health and all that kind of stuff, as well as physical health. And so, and I think also just, related to what we're talking about recently, which is, is there equality in the healthcare system for all races and for all women and or people who identify themselves as women, to have successful outcomes in C-sections or in vaginal birth? And that's not necessarily the case, especially for, a lot of specifically, which I'm learning a lot about right now, the Black population of women, which is very sad and very frustrating, and it has to change. So, specifically in Canada, we see the occurrence of C-section rates at about 29%, 32% of births, and technically those are high statistics. But one question that I always ask when people bring up stats is, okay, well, why though? Is it because, these are women who have labored for three days and they've pushed for 3 hours and then it becomes an emergency C-section? Are these interracial marriages where you have a small woman like myself at 5'4" and very tiny and a very tiny pelvis, married to a big, German guy, which I'm married to, with a big head, and all my children had 95th percentile heads and they just were not going to come out of my pelvis. So that, I would have died in childbirth a long time ago if I didn't have that option. So I think these are some of the things that we need to look into when we're looking at the statistics around C-sections. And I think that that is going to help to eliminate some of the stigma around C-sections, because right now, even in some of the conversations and wording that, healthcare professions are using, it can be quite damning and quite hurtful for women who have been through C-sections, because they are not necessarily negative. They can save a woman's life, they can save a baby's life, but they can also be long-term really beneficial for whatever reason. So, yeah. So that's sort of what kind of my reasoning to kind of bring about some of the information. And, a lot of what I got, when I delivered by C-section 9 years ago after 52 hours of labor, was, oh, you got the easy way out, or, oh, your recovery is going to be so much more less, or, well, it's not really real birth. And that really facilitated a lot of grief and anger and fear and shame and everything. And I look back now and I realize that, yeah, you know what, it probably did facilitate a lot of my postpartum anxiety and a lot of my postpartum. I don't think I specifically had postpartum depression, but I think, there's a potential that it could have shifted into that.
Well, it's like you already feel like no matter how your baby comes out, I think all moms are just like, you feel like you're doing everything wrong and you second guess like everything that you're doing. And so it's hard not to, I think, when there's like this, the vaginal birth is like what everybody strives for.
Yeah.
But, and then, so when you don't achieve that, you're like, this is one other thing that I haven't been able to do. And I think too, I think the language luckily is starting to change too, that you still see a lot of people say, did you have a natural birth? Right. And I think that
Mhm.
that hurts people that have had
Yeah.
a C-section, because who says their birth isn't natural too? It's right. Do you know what I
And
mean?
normal. Like, what is normal
What
anyways?
is normal?
Like, what is a
Exactly.
normal life? We don't even
Yeah.
have
Yeah.
an idea of that. So why would we kind of use that language with
Yeah.
birthing as
Yeah.
well? And it, unfortunately, it is still being used a lot, and we do need to
Yeah.
change that language, not just amongst healthcare professionals, but also just amongst women in general. Because,
Totally.
I had some really, really close girlfriends tell me that, oh, your birth wasn't normal then. And I'm like,
Yeah.
hold on a second. Whoa,
Yeah.
let's back this train up and let's discuss this further, because
Yeah.
I use it as an opportunity to engage them and teach them, you know,
Yeah.
proper, I guess, support and empowering language, which is super important, because then that will allow them to move on further and move forward, and maybe hopefully don't not to say that to another woman,
Totally.
um, whether they're in a practice with it or whether they're just speaking to a girlfriend.
Totally. Can I ask a question that I think would come off my head if I was like someone that was like pregnant? Is I would want to know, so then what do you like? I know that a lot of like probably the majority, well, actually, you tell me if I'm wrong, but I would guess that the majority of C-sections are not planned, right? I know some of them are, but like,
First time, yes,
yes. And
majority.
so, yes. So what would you like, what would be your advice for someone that is planning to have a C-section? Like as far as like, obviously, I think you've said
Like
like
a first
educate.
time mom.
Yes. Yes. Or even second, because maybe they haven't gone through any kind of prep before. I'm kind of going to
Right.
get into the physical part of it. But I think that like one thing you've said is like educate yourself, like just educate yourself about what happens during a C-section and
Hmm.
what that looks like after. Because I think if you like, you might not get a lot of that information you think you're going to get. So just
No, yeah.
educate yourself about that. But then I would also ask you like physically, like how do you suggest women prepare for a C-section?
So, just to kind of shed light on what a C-section is, I think is also important, because that is preparatory material to kind of
Yes.
allow you to understand, what is it that you're actually getting into.
Yes.
And I would hope that this would be a conversation that would be stimulated with the healthcare provider that is going to be either performing it, or, that you're going to be proceeding with the C-section, unless, of course, you go into labor early or something. So I guess one thing to note is that generally now, and I'm speaking from my knowledge of how they practice at BC Women's Hospital here in Canada, in Vancouver, is that it's approximately a 45-minute procedure. There's the pre-consultation work. So you go in and you get your blood work done, urine sample, you kind of get to chat with your doc, and then the anesthetist comes in, chats with you about what's going to happen. They kind of, I called it a little bit of a pep talk kind of thing, which is really great because it helps to ease anxiety. You understand, you see the faces of the people that are going to be in that room. You also need to know that you do actually have a choice whether you want a practicing um, physician that is still learning to do your procedure, or if like, so oh my gosh, what's the word I'm
Like a
looking for?
resident?
A resident,
Yeah.
or not. I requested not in my situation. And there were many reasons around that. And so generally you end up going in and getting a spinal done. So that means that they ultrasound guided spinal. So they usually go in through or close to and around your low back ish area. And that is done with a needle, and it's sort of the freezing, right? So that you do not feel anything from generally around your diaphragm area, chest area below. And then, of course, they have to catheterize you for the surgery. And so the general surgical sort of entry point is just above the pubic symphysis. And then they do that lower bikini line cut. And then they will go through the layers to reach the uterus. And I'm not going to get into detail. You can obviously look that up. I don't think that we need to know all the details sometimes. I find it fascinating. But and then basically the baby is birthed through this incision, and then now is rested on the mother unless there's issues. So in my situation at BC Women's, they were extremely supportive of sort of C-section birthing moms, and they allowed us to have immediate skin to skin. You didn't even have to have the screen up. You know, there were a lot of they did not tie your hands down the first time they did, because it was an emergency section. That was a whole different situation. But generally, if it's planned, you can speak to your physician about a lot of these things that you do have some choice in, which is great. And understanding that you do have some choice in these areas. And then, of course, the suturing is done layer by layer. And then now they're starting to dress the wounds with what's called like a honeycomb type bandage, which does just help with the healing, which is great. And so preparing for a C-section. So how do you want to prepare for this if this is something that you are going to have done? I would say, like I just said, you know, knowledge is power. Know the procedure, know what you're getting into. You know, go in with a bunch of questions to ask your physician prior. So your OBGYN, who would be performing it prior. Another huge thing is find your village. So really make sure that you have supports around you. So beyond your husband, so friends, family that can, I guess in these times it's a bit more difficult, but I mean, they can still drop off food. They could go shopping for you, drop off groceries. They could go to the store and grab anything that you need, so that your husband doesn't necessarily have to be the one leaving to do that, especially if you have other smaller kids around. The week or day before, so you want to think about what really helped me personally is being quite clean with my diet, because it did help that postpartum bowel movement that you will have after. Made it a lot easier, a lot less irritable, which was great. So, I mean, I tend to, suggest things like, smoothie in the morning, a more like very kind of vegetable soup kind of based diet, to just sort of help make sure that there's these things that are easy to process before you go in for surgery, are actually really helpful, because you're going to be asked to fast from, usually it's like after dinner time until your surgery the previous day. So, but that was very helpful for me.
I've never thought of that, telling people to like think of their diet before. I've never thought of that.
Yeah, because the gut is impacted, right? Because
totally,
are going
absolutely.
In
I just never
abdominal surgery, and if you were working on an abdominal surgical ward, you would be asked to do these things, right?
Totally.
They usually get you to do a clean out. So,
totally.
I mean, not that you need to go to that extreme, but you want to think about these things for sure.
Totally.
Right?
What about, because we're seeing like so many women come in now before they have a birth that are planning to have a vaginal birth, that they're like, tell me about my pelvic floor and tell me about exercise and everything. And I think C-section moms feel they're not part of that. And that's what I'm saying is like, if you knew that you were going into having a C-section, what kinds of things can those women like prepare themselves? Because I always tell them it's actually, in a lot of ways, it's not that different. Just because the parts are all connected. Our babies come out of different places, but the parts are very much connected, and the focus after is similar. So I just wonder if there's any, like, just kind of speak to that really quickly.
So like, I mean, if I actually do highly recommend you see a pelvic floor physio, or a physio that's trained in pelvic health and women's health prior to having any type of delivery.
Sure. Yeah.
And because even for those women that plan on having a vaginal delivery, I mean, things can change in an instant. So it's really good to go in with that support and knowledge to deal with any outcome. So, some of the things that I work with women on is, a lot of release work. So mobilizing your thorax, releasing the thorax, releasing through the lumbopelvic hip girdle region, working on offloading, working on your breath, down training of the pelvic floor. So relaxation of the pelvic floor, because post-surgery, your pelvic floor will actually grip and brace in an attempt to support your body and your body in standing, because you all of a sudden have this baby, right? Also to add to the weight. And then, your abdominal wall has been compromised because of the surgery. So I think, really working on, not necessarily working on core exercises, especially at that end part of the pregnancy, but making sure that your brain body connection is there, that it knows, okay, I feel that pelvic floor connection. Yes. And I know that I can engage my abdominal wall. And that's sort of the sensation that I'm going to want to feel and work towards postpartum. Especially after a section, right? Because the abdominal wall is a huge component of recovery, just as much as it would be after vaginal delivery.
Totally. And that's the thing, is like, I think, like, I've only had like vaginal deliveries, but I also know, like, I know, not that it feels the same, but like things do feel some similarities. But just from hearing all my clients that have had C-sections too, is that what I would describe, and like use your terminology too, is I would describe that afterwards people are like, I just felt like nothing was connected, and the muscles that I felt before were just not there after. And so I think that, like, what you're saying is, like, if women can feel that, they at least know, okay, that's what, like, on versus off, kind of what those muscles even felt like, so that when afterwards, when they're having a hard time connecting, you at least remember what it felt like, so that you can kind of guide them back to work again. So
yeah, and learning some different like yoga stretches and movement related things that you can do post C-section quite early that are going to be very helpful.
Yeah.
To offload, to get that breath back, because sometimes, if baby gets stuck a little bit, there's a bit of tugging with the C-section as well, and that draws down on the diaphragm and can cause, some imbalances with the pelvic floor and diaphragm and abdominal wall too. So, and then of course knowing, what to do in those acute postpartum stages, which are really important post C-section, like what are positions of comfort for a post C-section mom? How do you splint your abdominal wall so that you can cough or laugh or, have a bowel movement? What kind of ergonomics are really important for, standing, or for carrying the baby carrier, like the car seat, carrying the baby, right?
Actually,
And
Tamarah, speak to that really quickly. What were you given, like, or what most women given now, like, guidance from their OBGYN when they leave? Like, what will they be sent home with? Information wise, is like, don't do this, do this. Like, you know what I'm getting at? I'm kind of mean, like, they'll be like, don't
nothing
lift.
really. That's why I'm kind of like,
Exactly. Like, exactly. And I think that that's what women are expecting, is that they'll be given some guidance, and you're not given much. And so what do you, cause like realistically, and you just touched on it, like, our lives are really heavy as new moms, and there's certain things we can't really avoid. So yes.
So those are kind of the top things that I would say, like acute postpartum care, like of your body. So, the understanding the bleeding. Sometimes you can bleed longer when you've had a C-section, like positions of comfort, side lying. So really trying to, once you have, if you're choosing to breastfeed, that position of side lying, and learning to breastfeed and side lie if baby is latching really well. If they're not latching well, having those extra supports of, a really good feeding chair and a really good pillows or breastfeeding pillow or something to support the baby, so you're not leaning forward, you're not having to do a lot of the work, which I mean is common sense, but sometimes you just do what you can do when you're trying to get your baby fed, right? And you're exhausted. So having things like, I had the Halo bassinet, and it was absolutely brilliant for post C-section. And I would recommend it to anyone and everyone, because it really just allows you to be able to, swivel that baby towards you, and it's a soft pull down of the, and so you can get baby out easily. So really trying to find and use things that are going to help you. So I believe in, when your body's ready, a bit of an abdominal support, especially with the C-section moms, or a lumbopelvic hip support once you're up and moving. I found that using a wrap to put my babies in was actually really helpful, especially because I have 4 and I had a toddler at home, or 2 or 3 most of the time. So that was also really helpful. Not carrying the car seat. So that's why I had the wrap literally attached to me all the time, and I would take baby out of the car seat and put baby on me at any of my appointments, so that I wasn't physically hauling around this really heavy car seat at the same time. Now that can be different for everybody. Some people are not comfortable taking baby out, but I just felt that it was less of a massive awkward weight, right? Because car seats are pretty awkward to be hauling around. And then, really just wound management and care is super important. So, get some silicone strips, learn, what is normal, what isn't normal in terms of your wound care. And generally they'll educate you about pain management and wound care before you leave the hospital. But really and truly, there's very little else that they will
Will
talk
they
to you.
tell you, like here, they don't say anything about like silicone strips, but will they tell, no, that's something that women have to kind of understand on their own, correct? Yeah.
Usually.
Yes. So can you just like elaborate on that a little bit? Because I've heard wondrous things about them.
So the silicone strips are basically, I wish I had a picture, but
It looks like a long Band-Aid, basically.
yeah, it's a long band, and basically you're kind of putting it along the scar, and it just really helps with healing and support of healing. That's the idea behind it. So I think, in in using one, you're working towards better wound management, better scar management, better care. Now, it's not going to, you still have to do all the work of managing the scar appropriately after, but it does help also if there's sensitization around the scar, sensitivity. You're not going to feel that with rubbing from like pants or, like a band or anything like that as well. So it's a bit protective in a way as well.
Okay, cool. Good to know. I had a
So,
friend that just had a C-section a few weeks ago, and she called within, I don't know, a week, and she said, and I think that this would be kind of, tell me, because you've gone through it, the major things that she was noticing are that, like, I'm in so much pain, and she wasn't taking her pain meds because she was scared to get addicted to them, but she wasn't doing much of that, and she was finding that, like, she's like, I wanted to hold up my belly all the time. So I think that you're saying that, like, that would be what the band or like the support garment would kind of give you. And she was saying, like, of course I'm like avoiding lifting she had twins, but she's like, of course I'm avoiding lifting my babies. My husband's here to help. But when I like go to get out of bed or change positions, I'm like in agony. And so like, she's like, I have to move. So,
I would say, like, teaching her to splint properly, with a pillow, or get a band on her. That kind of stuff would be very
totally. And I think, is this where you also would say too, that like, if you kind of learn how to like connect with those muscles beforehand, you kind of know how to like encourage them. They're not going to feel strong. They're not going to feel like they're doing very much. Mm-hmm. It's kind of like after, I think that a lot of women feel like this, like they can't control anything. Whereas having a bit of awareness of what muscles you're trying to get to help you can act like help the band a little bit. Yeah.
Absolutely. And I think the other important thing too is like, we're almost forced back to a norm or a routine very quickly, which I think with any birth is wrong. Like, we do have to take into account like this kind of societal pressure to get back to your pre-pregnancy state, whatever that is, be it physical or, body wise or whatever, is a bit sort of is the wrong language to be using with respect to, recovery, because really and truly, like after a C-section specifically, there's going to be some soreness. So pain management is really important, especially in those first 3 to 5 days post C-section. Because if your pain increases, there's a lot of discussion around pain science and that kind of stuff. And I think understanding what pain does to the body and the mind and whatnot, it doesn't facilitate healing really well. So we want to get that pain management under control. And that can be anything from using a band, heat, ice, gentle movement based stuff, or medication, depending on the person. And then, you know, of course, trying to improve and ensure that you have good gut health, because, you know, having proper bowel and bladder movements is really important to that pain management side of things as well. And then watching for infection and knowing when things may not be right. So if you are still in what you feel to be an abnormal amount of pain at the certain stage you're at postpartum, let's say a week or whatever, and you feel that there's an issue, then you do need to seek, um, you know, answers and support from your healthcare provider, because there could be something that is not visibly there that you're seeing that could be an issue. And so we always say to, you know, watch for any redness, increased pain, loss of mobility, swelling, all that kind of stuff. And then, you know, the first week or two, you know, really like minimize what you have to do, to try to really support your body with healing more than anything. So that just goes back to the whole notion of like calling on your village, right? And, you know, there was a study done that was on like post C-section exercises that was done in that very, very initial stage, like in the hospital, and like working on your breath they did, and ankle and leg pumps, and, you know, getting up and walking. Because I mean, you get up, you know, surgical patients really early, and there's a reason for that, right? It helps the body, you know, get back to a norm, so to speak, of function. And so, you know, ensuring that you're not, walking too much, but that you're able to move well. Because if you aren't, then you might want to go, okay, maybe something's not right. And then of course we get into that like scar management, and because that's generally where people tend to feel that pain, and scar pain is very common. And, you know, basically 1 in 5 moms report issues with infection. And, you know, there are women that do, 90% of women experience pain on the incision side, right side more than left. That can be, some people say that's surgeon handedness, but who knows, right? So there is a high incidence of, you know, scar pain, but it does reduce, of course. And then, of course, you don't get a lot of education on scar management, what you should be doing after those initial stages of healing. So those 4 to 6 weeks of healing. So that's important as well, right? So, you know, making sure you're becoming, because a C-section can be obviously unexpected. So really, you know, look at the scar, look at your belly, you know, try to identify with it the best you can. And if you can't, then try to seek some support around that, because that's really important, because that scar can actually breed pain because of that inability to connect with it, or that, you know, and that can be all based around, you know, trauma and whatnot from the actual delivery. And it's real pain. It's not fake pain, it's real pain. And you know, the mind is very powerful. So it's important to know that that can be a facilitator.
Totally. And I think that a lot of people think, like, whenever they hear, like, I look at my hair and I think, oh my God, I can't wait for my haircut tomorrow. Anyways, I think a lot of people with like C-section scars, they think like, oh, the only reason I would massage it is for appearance. But maybe just speak to that really quickly, of like what some of the implications, or like how your body might be feeling the effects of that scar. Yeah.
Well, I mean, I always say, you know, connect with it, look at it, admire it, right? Identify with it. One thing that I, you know, learned was how to, on my own, was how to work on desensitization. What does that mean? And it means something different for everybody, right? So some people, they can meet the scar with their hands right away, but some people can't. So, you know, some people, you know, take a paintbrush or a makeup brush or some soft surface, or, you know, something to it, so that you can start to feel what it feels like, and identify different areas that feel different. And then you can, you know, work on that desensitization of the scar, and then you can move into the mobilization strategies of the scar. So, you know, learning how to move it, manipulate it, whatever. And a lot of these things are taught obviously in a postpartum consult with a pelvic health physio or women's health physio that's trained appropriately. And, you know, learning how to stretch the scar, and learning how to move the body to facilitate stretch of the scar, because you need hip hip and knee extension, but that can be inhibited by the scar. You need, thoracic rotation, you need lumbar flexion extension, but that can be inhibited by the scar or the pain or whatever. So learning how to, move in different ways, aka stretch or whatever you want to call it, to help improve that scar mobility as well. Then also abdominal massage. So not just massage around the scar, but massaging around the whole abdominal area, because abdominal surgery affects the whole abdominal area. Learning what deep versus superficial mobility work is with respect to the scar. I always resort to kind of like yoga as movement, because breath is so important for, this relationship between healing the scar, the pelvic floor, the abdominal wall, the diaphragm, all of that kind of stuff. And so why is it important? Because, you need to increase the elasticity, you need to remodel, it helps remodel connective tissue, you get, decreased scar immobility, which then helps to improve like all of this neuromuscular control of like your deep system and just movement mechanics. So like you want to run, well, you need hip and knee extension, you need your core to work well. So, those things are really why you want to do all this work.
I saw someone describe it the other day, I don't know, on social media or something. I really like the visuals. They describe like the scar, but then everything underneath is like the iceberg that's below, that there's like things going on below that scar, like that tissue affects, like your hip and knee and your bladder and your ribs, like everything that's underneath there, it has an effect on. Yeah.
Exactly. And that's what I mean also by like making sure that, that what your body is going through, because you've never, well, some women won't have experienced a C-section before. So, knowing what, gaining the knowledge as to what is quote normal post C-section, and then being honest with yourself and going and seeking support and help if you feel like something's not normal, because who knows, because there is a lot below the surface that can be not doing great, for example.
And I think that like stuff like this is important. Like I want this to reach people that are pregnant or that have friends that are about to have a C-section, because I think that this is all helpful, that when they're afterwards, when they feel like their life is so different and their body's so different, it's like, I heard about this and I get that there's things I can do about it, instead like, oh my God, like I don't know what to do. Yeah.
Exactly. So
okay, we have to be mindful of time. So
yes.
So you tell us your biggest pearls for the end here. Sorry if I'm getting you off track.
So no, I guess the pearls are, number one, let's change the language around C-sections. Let's stop facilitating stigma and fear and poor language. So it's not using words like normal and natural and identifying, that it is birth no matter what, but also identifying that, sometimes the language used like, oh, well, you had the baby's fine, at least the baby's fine, that still can be not very supportive. So thinking about our language before we actually proceed with speaking with patients about it, knowing that it can be a trauma. And so on understanding, where to get help postpartum for that kind of stuff, because you're not necessarily going to be given that information. A couple other pearls would be, check your diet before you go in for your C-section. Take care of your body after. So slow down, know that it's okay to slow down, know that that's what the healing requires. Ask lots of questions, and make sure you go for a pre and postpartum follow-up. So prenatally, you can learn a lot of this information. Postnatally, you can get a lot of support with finding the right garment, learning how to do the scar massage, learning how to, reconnect with your deep core and abdominal wall. And so I think those would be kind of the main things that I would say. The biggest thing for me is like, if you have questions before you deliver, go and see someone. And if you, because there's a lot that can be talked about prior, And then obviously postpartum, go and get some support as well. If you feel like it's too much, I mean, we're doing telehealth now, so you can always reach out and get a lot of education through that avenue as well.
Mm-hmm.
So that's
Totally.
kind of,
I think
yeah.
it's awesome. I think at the end of the day, like I think you too, probably I receive a lot of messages from people just saying like, I don't know what to do and I'm so confused. And I think, okay, well, that's what we can help with. Like, that's what we can talk to on an individual basis. Here are the things that are going on with you, and like help you figure out a plan to like get back to feeling kind of like proud of yourself again, or like feeling strong, or do you know what I mean? Like feeling whole, I want to say, because I think a lot of women just
Yeah.
feel like their part of them is missing and they don't know what to do about it. And it's scary because they don't feel like they have control. Right. And
Yeah.
so that like you shouldn't have to go through that. Yeah. But
Yeah. And I think,
you do need to reach out. Yeah.
totally.
Yeah.
And I think it's important um, to, to reach out and
Yeah.
find, and find your village first. Like that's
Exactly.
the key to you. Like, I mean, especially in these times where, you can get support.
Exactly. And so Tamarah's like a wealth of knowledge in this area. So feel free after you watch this video to list any questions that you have
Mhm.
after this. And again, like we're trying to use this community as a way to kind of tell you all the stuff that's not really out there, give you some ideas of some of the things that may be on your mind, and like help you find the help that you need. Okay. So I'm going to sign off for now. I'll let you know when we have picked our topic for next week. Thank you so much, Tamarah, for
Thank you,
taking the time to do this. And now you've got to skedaddle to school.
Thank you so much for having me.
Okay. Okay. Bye.
Bye.